My name is Kathy Busby. I have been an employee here for 30 years, and I've worked several years in a row on Nurses Week activities. Last year we did a PowerPoint looking at the year of the nurse for the last 100 years. So this year we looked at pandemics and epidemics for the last 100 years. One of the things that got me interested in this idea is I was doing a lot of the vaccine clinics, and so when I would be at the big vaccine clinic at 12th Street, a lot of my older patients would tell me, oh yeah, I remember getting my polio vaccine, and that got me thinking about other epidemics and what we as Americans did to help fight the epidemic. So that's what got me started on my research. So the very first one I looked at was the typhoid epidemic in 1906. And a lot of people have heard about Typhoid Mary. She was a cook. She cooked for rich families in New York City. She also cooked in a hospital and was an asymptomatic carrier of typhoid. She was found to be directly linked to 122 cases, and 5 of those people died. At the time, there was no antibiotics. They didn't have a vaccine till 1911. So basically, the only thing they could do was quarantine her and keep her from cooking. She was quarantined twice against her will. And at that time, the health officer could come and forcibly remove you from your home and put you in a quarantine hospital. And she ended out her days living in a convent because she couldn't find work anymore after, she got labeled Typhoid Mary. And then we kind of looked at other epidemics. There was a diphtheria epidemic that was fortunately stopped when we developed a vaccine in about 1920. We also developed antibiotics in the 40s. The next one I looked at was polio, and turns out there were 2 polio epidemics. One in 1916, where lots of people died because they didn't have an iron lung. They developed the iron lung in the 1950s so that all these people that developed respiratory symptoms, they could put them in the iron lung until that got better. And most people did actually get out of the iron lung. There were a few that didn't, and there's actually a man from Arkansas that was in it up until his old age because he just didn't develop his respiratory muscles. And that's interesting because they had the same kind of vaccine race that we had with the COVID vaccine. They had the first one was in 1955 and protected against the central nervous system attack by the polio virus. And then in 1962, they developed the oral. And that's what I can remember as a child, being everybody going to the local high school, and you got a drop on a sugar cube and you were vaccinated. And that actually took care of the GI effect and the central nervous effect. So it kept the spread down. And that was really interesting. And obviously, when you have that kind of oral administered medicine, you don't have to have nurses and doctors to do that. So it made it easier to get out in the community. We've had many different flu epidemics, starting in 1958 with the Hong Kong flu. Something I noticed about all those is that they would start in the U.S. in the summer, and they'd just kind of be low level. But when school would start, you would see, as people started packing in, then you would see the levels rise. There was a flu epidemic in the 60s that actually, Christmas break kind of broke the cycle. And it had started ramping up in October, but they had Christmas break, kids out of school, and that just really broke the epidemic right there. Then we moved on to looking at 1918 and looking at COVID. And there were some things that were very similar in that it was widespread, had early death tolls, had different peaks, and there wasn't really much we could do. As same as in 1918, we had masking and we had social distancing and using disinfectants. That's about it. Some of the other thing we looked at with 1918 and COVID was looking at the news reports and social media. Some of it was quite the same. The reason the 1918 flu pandemic is called the Spanish flu is that it occurred during World War I, and none of the countries fighting the war wanted to give their enemies an unfair advantage by saying, oh, they're sick. But Spain was neutral. So they reported about the flu, which is how it's got its nickname. In this country, President Woodrow Wilson got together with all the major newspapers and said, you know, we want upbeat news. We don't want to report this. We don't want to ruin public morale. So they printed half-truths, they printed lies, and pretty much kept the American public in the dark. And we contrasted that with today, well, social media. That has been the background and the hotbed for lies, mistruths, inaccurate information. And one of the roles that nurses have played is to counteract that misinformation and to point people in the right direction for accurate information. So that was an interesting parallel that we looked at. In 1918, people generally complied with quarantining, distancing, and wearing masks because it was the patriotic right thing to do. Whereas in 2020, it became a political issue and a social issue. And we see that too with the vaccinations. You know, in the polio era, people were terrified of polio, even though it didn't infect or hurt as many people. So people were happy to go and get their vaccinations. But now people look at, well, the political effect and say, you know, well, if I only have a 1% chance of dying, why would I risk taking the vaccine? Well, there's a reason we don't have polio anymore, and that's because of vaccines. U.S. has been polio-free since 1979, and there are only 3 countries in the world that still have polio. So that's got to tell you something right there. I would like for people to know, as a nurse, that we're sources of accurate information about keeping yourself safe during the pandemic, keeping your neighbors safe, and taking measures to reduce everyone's risk. That is getting a vaccine. And nurses have been seen this whole time. They've been in the front lines, on the front pages, and in the forward thoughts of most people, because we've been there and we'll always be there. We were there in 1918 when there was nothing but a piece of gauze between us and the pandemic. And we're here again. We've got better PPE and we have a vaccine, but that's my take-home message is to, you know, the nurses are there, we'll be there, and we'll take care of you.
22 years ago, as a new graduate, I would have never thought that I would be here telling you this story today. In June of last year, I was part of the COVID pandemic. Here at Uams Regional Campus in Helena, we were a small clinic swabbing people for COVID daily. My husband was also a frontline worker. He is a welding instructor for the Arkansas Department of Corrections. And so he had inmates that were coming in every day to complete training so they would have a way to make a livelihood for their families after they were released from prison. During this time, I also was able to participate in the mobile COVID unit. Dr. Jennifer Hunt and her group came to Helena in order to reach the rural Delta, the people that didn't really have access. I was actually able to work with her on 3 different occasions in the mobile unit. We became friends. I remember it was a Tuesday night. I was headed home and my husband called me. And he said, I have a fever. He said, I know I have COVID. And I said, well, how do you know? And he said, everybody's got it. And I was concerned, but not really worried because I was a nurse. I knew that I would be able to take care of him. My main concern was not letting everyone in my house get sick. The next morning, I took him to get him swabbed, and it was immediately positive within 24 hours. I was a little scared, but not frightened, I guess you would say, not worried, frightened. It's going to run its course in a few days and we're going to be okay. After 9 days of fever and corresponding with Dr. Hunt, kind of trying to see when I might need to take him to the hospital. At this point, I was very worried because he had 103 fever for about 8 days. His pulse ox got down to 93. He was even a little confused and was very reluctant to go to the hospital. But we kind of had to tell him in a nice way, either you can end up on a ventilator at a local hospital or we can get you the best care available in Arkansas. He decided, okay, I'll go. When I dropped him off in the ER, that was probably one of the hardest things I've ever done. You hear people say, I had to drop my loved one off and I didn't see them for this amount of time. And you think that's so sad. It's more than sad, especially when you're a nurse, because you are the person that takes care of people and you can't take care of your loved one. He had his cell phone and he was able to call me and he said, I'm okay. Well, over the next 24 hours, he kind of got worse. He was admitted to the COVID unit. The first night there, after leaving the ER, a nurse called me and she told me that he was so sick by the time he got to the COVID floor that she didn't even take his shoes off because he was so short of breath. She was just glad to get him in the bed. This lady called me early the next morning after he was admitted. She told me that she was from infection control. She was giving me some information about his status and exactly what they would be doing for him. Well, while I was speaking with her, I got a text message saying that my son had tested positive. And so I was very upset talking to her. And she was just this grandmotherly voice. And she said, listen to me. Your child is going to be fine. Your husband is going to get the best care available to him in the state of Arkansas. I calmed down then. I felt like, okay, these people know what they're doing and they're gonna make him well. My husband the next 2 days did not improve. He continued to get worse. He told me at one time he couldn't even turn his head to turn over to sleep because he was totally out of breath. And of course, UAMS staff was doing everything they could for him. We got a call and they asked my husband if he would be interested in participating in a research project. They talked to him about convalescent plasma. So at that point, Dr. Vyas called me. He was discussing it with me and he said, he didn't push us to do it either way. He just wanted to make sure we had the information. My husband and I talked about it and he said, what choice do I have other than to participate? He was, and he will proudly admit this, the 12th person at UAMS in this research study to receive convalescent plasma. And when he received that plasma, in 24 hours, his total health panel, breathing, labs, everything turned around. The importance of research at UAMS, I get emotional talking about it, but people think about research and they don't think about who starts that, who initiates, who thinks about those things. Whoever thought of this and to pursue it and was willing to help people at UAMS through convalescent plasma research, I'm eternally grateful to them. My husband received 2 bags of convalescent plasma and he was discharged, I believe it was the next day. When I pulled up in the circular drive to pick him up, I was bawling. I mean, I was just so emotional. And he came to the vehicle and he was like so different. He was so weak. Within 2 weeks, he was almost back to his self. He was 42 years old, healthy, did not take any medications. He was the person you would think, he'll get COVID and be over in a few days. COVID can be very serious. And so we followed the quarantine guidelines. They laugh because my husband and son got out of quarantine before my daughter and I did. So 28 days later that I finished my quarantine, I was able to come back to work. We kind of felt like it became full circle for us. We were patients at Uams. I was a nurse there. We went through all of the dropping them off at the door, that grandmotherly voice that called me from infection control the morning after was wonderful. The nurses that said, call me anytime. This is the number. You're not bothering me. That was wonderful. My coworkers that, called, what can I do? I'm here in Little Rock. What do you need? Okay, he needed a phone charger. That's not a big deal for most people, but that was a way that I had a lifeline straight to him. He got the charger. People, family members that lived in that area were 2 hours away. They would bring him a meal. We were so blessed because my UAMS family was there for me when I couldn't physically touch him. When I came back to work after that 28 days, totally changed my view on nursing. All these events have helped me to realize how important we each play a role in the UAMS family and how important it is that we continue to fight this pandemic and champion for our patients and champion for each other.
I feel COVID-19 made everything in life more important. As a nurse, a mom, a daughter, and a citizen, I wore many hats and masks. As we lived through this pandemic, all this past year and a half, the waiting rooms were empty, but that didn't mean there weren't loved ones waiting to hear how their loved ones were doing in the operating room. Communicating is always important, but it seemed more important now. Washing your hands should always be a priority, and it should be a common practice, but I think the public is cleaner now than they ever have been. Maybe all of this was especially important because I was on both sides of the spectrum with all the roles that I played during this pandemic. I feel the need to be positive to those around me when I too was afraid of what was unknown. I missed being able to hug people, but especially my 90-year-old mother. I couldn't visit her in ICU when she was there, but the nurses were wonderful, and they were excellent in communicating her progress to me. They even put their cell phone by her head so that I could talk to her when she couldn't even respond. We probably will be wearing these masks for a while yet, but I have been wearing them for 50 years now, so it's no big deal. What's on the other side of the mask is what is very important. This horrible virus that has taken so many of our loved ones and friends, including my sweet mama.